Vermillion is leading the way for South Dakota today, now carrying blood on its EMS ambulances. In fact, Vermillion EMS says the Clay County town is the very first community in South Dakota to implement something called the Blood Out of Hospital Acute Resuscitation Program.
Yeah, important information, and it actually provides access to blood products in the field for emergency care patients. KTIV's Taylor Deckert shows how in those first critical moments after the injury, time matters.
Somebody does not get blood within an hour, they are statistically more likely to die.
For a patient in South Dakota, the clock ticks faster than an ambulance can drive. But that time is being extended with the help of these blood services.
By having this available, you can get the blood in them sooner when they're more likely to need it, and then get them to the hospital and they can start working on them in their trauma center.
This change in services of carrying this blood here in this cooler is going to help close the gap to save more lives.
We could treat them immediately, like on the roadside, in their house, what have you, and then we could do it right there instead of just having to pick them up as quick as we can and get them to the hospital, where ultimately they'll be getting surgery and blood products in the meantime.
Training for critical care paramedics included a 3 to 4 month program and getting an endorsement from the state of South Dakota.
And then we did like the operations as from like the day-to-day to even transfusing like to a patient, like the steps on what needed to be done.
This program adds an important tool to trauma response, but without community blood donations, it would not be possible.
Every unit of blood on these ambulances started as a donation from a neighbor. You are now quite literally riding along with first responders to save a life.
They hope this is the beginning of a new standard of care for the whole state of South Dakota.
We can't have this blood without people donating. With LifeServe, we try to keep all blood within the community. So if somebody donates here, it is likely that their blood is going out on a local ambulance.
In Vermillion, Taylor Deckert, KTIV News 4.
Go ahead and take a look at your screen tonight. Now, this is the current blood inventory for LifeServe Blood Center. 5 of the 8 blood types are at a critically low level. That includes O positive, O negative, as well as A positive and A negative and B negative.
You can help support the blood supply in South Dakota. In fact, the Vermillion Fire and EMS Blood Drive is coming up Thursday, April 30th from 12:30 p.m. to 6 p.m. Learn more on how to save your spot by going to the story at KTIV.com.